Having a child is always a momentous occasion, but a complication leading up to a birth is nerve-wracking for any family, especially those who don't live close to specialized medical care.
The March of Dimes tracks those maternity care deserts, which are areas of the state where it is much harder to get specialized obstetrics care, and works to provide support for families there. Tonight I profile one family who lived through that challenge and was helped by the March of Dimes. At just 28 weeks, Stacy Brown was airlifted from College Station to the medical center here in Houston.
About 12 hours after I got there, they came in and said, "What we're doing isn't working. We think we need to deliver these babies."
Her triplets arrived 11 and a half weeks early, each baby weighing a little over 3 pounds. It was a scary and trying time for the Browns, who already had 2 other children at home in College Station. The next 72 days would become a juggling act, being so far from the hospital, but they weren't alone.
Would take off 1 day a week to go down to spend, because the NICU would only allow the siblings in for 20 minutes at a time. And so
Eric was working and caring for their 2 older children as well.
Our hospital experiences when we first got connected with the March of Dimes, thankfully they had some great services and great resources.
The Brown family is not alone in this situation. The March of Dimes Maternity Care Deserts report looks at areas where moms don't have as much access to obstetrics care. According to the report, for mothers-to-be and babies in Harris, Galveston, Fort Bend, Montgomery, and Brazoria counties, care is accessible. However, when you get out of these 5 counties, as you can see on this map, it's less accessible, and some more rural counties are even considered deserts for care. The criteria is based on the number of hospitals that provide OB services, the number of OB providers, and the number of women without health insurance. Children's Memorial Hermann Hospital here in Houston is aware of this problem and is reaching out to physicians in rural areas.
And our maternal fetal medicines build relationships with those doctors so they feel comfortable enough to be able to consult them if they need them, or to be able to go to any one of our sister hospitals.
They're able to consult on issues that might arise with mothers or babies.
The good thing about Children's Memorial Hermann is that we have 9 sister facilities around the city that pretty much cover the whole Houston region.
Telemedicine has also been a game changer for patients in rural areas needing more specialized care. It cuts down on the number of times they have to drive to a clinic, and during COVID, it is especially helpful.
So a lot of these patients that are out in these desert areas or that have our complications that we're fairly familiar with, such as diabetes or hypertension, this allows them, because they have so many appointments as it is, to be able to work with their physician over telehealth.
Today, the Brown triplets are precocious, happy 3-year-olds.
Amazing. They are perfectly healthy.
Their parents, Eric and Stacy, are thankful to the March of Dimes and their doctors who treated their girls. Today, March of Dimes has a My NICU Baby app that is available for all families with babies in any NICU, regardless of location. During the pandemic, one of the many ways that March of Dimes has stepped up care is to help provide tablets so that parents separated from their children by distance and/or COVID restrictions can still see their babies virtually.